We're back. It's a growing epidemic in our communities and throughout the country. We're talking about heroin. Anti-drug advocates say the problem stems from painkiller addiction, and now they're looking to stop it right from the start. Once again, here's Zachary Quiche.
On a billboard overlooking 42nd and 8th Avenue in Times Square today, a campaign focusing on educating the community about opiate abuse and the growing heroin epidemic.
The medical community caused this epidemic by overprescribing pain medicine.
You decide before they prescribe is a cry for help, a preventative measure before it's too late.
4 years ago, last Monday, we lost our son, Stephen. 2 prescription pills crossover to heroin.
In Stephen's case, his addiction started with something as simple as a sports injury.
The face of a drug addict today is much different than what people think of a drug addict.
And the varying types and potency of drugs are changing too. Fentanyl, a synthetic opioid, is 100 times more potent than morphine, 50 times more powerful than heroin.
Fentanyl is different. It's completely synthetic. It's made in a laboratory, and there's a type that's used in prescriptions, but it can also be made illegally, and that's happening right now. It's being illicitly manufactured in Mexico, smuggled in. It's being mixed into the heroin to make the heroin stronger.
A partnership for a drug-free New Jersey is trying to pass a bill that would address this growing epidemic. Reporting in Manhattan, I'm Zachary Quiche, Fox 5 News.
Joining us now for more, Angelo Valente, the Executive Director of the Partnership for a Drug-Free New Jersey, and Joel Pomales, who is the Clinical Outreach Coordinator and Director of Advocacy for College Recovery and is also now in recovery from a substance use disorder. Angelo, many have pointed to prescription painkillers as the reason for this. Is that actually true?
There's absolutely no doubt about that. The link between prescription painkillers and heroin is significant. Many people who are heroin addicts started as a result of entering in through prescription drugs. Okay. So we think it's crucial, especially with young people, because the brain is still developing until a child well into their 20s, that we look at alternatives to opiates, that we educate families about the prescriptions that their doctors are providing to them and to their children. And we think that's a great way to be able to reverse the epidemic that we see here in New Jersey and throughout the country.
For many people who seem to think, you mentioned 20s, but we know that the face, it was mentioned in the piece, of a typical person who's struggling with this type of addiction, there is no one next to each other. They all have a common denominator. It just runs the gamut of types and personalities and ages, right?
Without a doubt, because it is a brain disease, and the prescription, especially opiate-based prescriptions, change the way the brain functions. So it could impact anyone, and it does impact everyone. I mean, one of the things that we have found is that for many years, people thought that heroin addiction and prescription drug addiction was something that was only in an inner city situation. We know that's not true. In fact, on the contrary, we're seeing that people are being afflicted with this disease throughout the country, in suburban areas, in rural areas, in urban settings, in wealthy communities, in suburbs. So I think it's crucial that everyone be aware that this can happen to them.
Help me, let's do a timeline here, if you will. It seemed like heroin was foregone. It was associated with like jazz musicians or the 40s or something like that. And now we're hearing more stories about it coming back, when I thought that the fight was like oxycodone and types like that. You're saying there is a correlation?
Without a doubt. And we've seen over the last 20 years as prescriptions for opiate-based drugs have increased, so have the link between those prescriptions and those that are afflicted with the heroin epidemic. So there's a direct link between the amount of prescriptions that are being prescribed and those folks that are now leading and going down the path of heroin.
Let's talk about, let's bring Joel in on the conversation. Joel, tell us what you do in your current position with your organization.
Well, for College Recovery, I am the Clinical Outreach Coordinator and Director of Advocacy, so I'm the liaison between service providers, so anybody in the healthcare field, and our organization, who are either our clients who are discharged or anybody who has a client that may need to come to us. So we are a young adult, ages 18 to 30, treatment facility in New Brunswick, New Jersey. We're a long-term program, 6 to 12 months. And so Advocacy Director, with that, it's a big piece to have some changes in the way that we address substance use disorders, improper treatment, lack of recovery support services for individuals who are coming out of treatment back into the community, and just an overhaul of the education. One of the biggest pieces that I advocate for and use my personal story to educate people is just we need a shift in public perception. So many people don't understand addiction as an illness or as a disease. It's very much considered a moral failing issue and a criminal justice issue rather than the public health issue that it needs to be addressed at. So I do a lot of that as well.
You mentioned, or we mentioned at the top, and you just touched on it yourself, about you had a personal connection with it. Share with us
Sure.
what your connection is.
So I'm a person in long-term recovery from a substance use disorder. For me, that means that I haven't used alcohol or any other drugs since 2011, just about 5 years. And how, a big part of it, like I mentioned, was the education piece. I really didn't know. I didn't know what addiction looked like. I had an image from the media and from movies and TV about what I thought somebody with this illness would look like, say a homeless person or somebody on the street living under a bridge. I didn't know that I was susceptible to addiction in the same way. And just also a lack of education on recovery. I didn't know what happened to people after they were living with this illness. I didn't know that recovery existed. So not having the education, not knowing the consequences, the risks of using, maybe a little bit from what I learned from some prevention programs, very, kind of scare tactics, possibly I could die or wind up in jail. I didn't, know like the actual process that happens with the illness and what that looks like and the impact that it could have. So from that, from my environment, from maybe being wired a little bit differently, being, a different chemical balance than some people have, being more susceptible to addiction, just being with friends and getting involved with different things.
How old were you when you first ran into this situation?
I was 13.
13.
Yeah, when I first started. And I didn't get introduced to opiates, to prescription pills, for a number of years till I was about 23. And
did you have an injury, or?
That wasn't my story. That's one of the biggest issues that we face now. There's a couple different pieces to it. Overprescribing from doctors, whether it's from a sports injury or from just any type of injury where a doctor's in a position to prescribe the medication and it's prescribed and either overused or abused, or even just, somebody that's more susceptible to addiction from the feeling that they get from the opiate, want to continue that use even after the prescription is ended. For me, it was just a social environment. It's kind of what people were doing. One substance kind of led to the next pretty easily once I was involved. So that's what people were doing, and I didn't know. Once again, the lack of education, and before I knew it, I was hooked. It lasted for too long. And
what was your wake up, Joel?
the same typical story of using prescription pills that led to heroin because of the price and the availability and all that. I fell victim to, and I watched it happen, and I was confused. I didn't know what was going on. Once again, the lack of education, and it just became enough. I had an opportunity to go into treatment. I tried a lot of different things on my own to stop and change, and I didn't know that I had an illness, so it was kind of just the feeling, just really, a long period of time of trying to change things on my own and failing, and just seeing where my life was at. It was really tough to not be able to focus on the things that were really important to me, like my education and my family and my employment and things like that.
And 2011 is when you went into the recovery program?
Yes.
And like you just mentioned, you've been sober since then?
Yep, I've been in recovery since 2011, yeah.
His story is a success story.
Absolutely.
Two questions I have for you. One, tell us about the bill
Sure.
that you all are fighting so hard to get through the legislature?
We think it's going to be a game changer, and it really will reverse the alarming trends and the epidemic that we see. Because, as Joel had mentioned, many people who are addicted to heroin started as a result of receiving a prescription drug from a doctor. And in many cases, they were adolescents. They were in an emergency room setting for example, a broken limb, a broken arm, or a sports injury. And in almost all of those situations, the doctor was not sharing information with the parents of the patient or with the patient about the addictive qualities of these medications, and also about alternatives. Alternatives that are not opiates that can provide the same kind of relief. So this bill would, it's Assembly Bill 3424 in the New Jersey legislature, would require doctors to have a conversation with the parents of patients 18 and under about what types of alternatives are available, and also what potentially the addictive qualities of the medication they are being prescribed. And this is all part of our overall effort with our campaign that was mentioned a few moments ago. Our campaign says you decide before they prescribe. And we think that all parents and all doctors should be sharing this information with each other.
They don't already do that?
Unfortunately, they don't. I mean, in some cases, you have doctors that will voluntarily be involved in this, and in many cases, you'll have prescriptions that are being prescribed without any information being shared.
3424.
Correct.
The last thing I wanted to know, and this was something I've always been curious about because we've seen reports on it, can a person have a predisposition to addiction? Is that possible, or is it something that's just acquired?
I think that there have been many studies that have indicated that it is addiction affects people in different ways, and that there in some situations, as Joel had mentioned, it might be a chemical reaction that is received by that individual from either the medicine they're receiving or the drugs they're taking that will wind up putting them in a position to desire those drugs in the future and become addicted to those particular drugs.
Good luck with the bill,
Thank you.
Angelo. We wish you well with that.
Thank you.
You are doing a good job, and
Thanks, sir.
continued success to you.
All
Thanks
right.
for telling your story to us.